All right, let's jump right into a really tough question. We're going to talk about a paradox today, one that's honestly kind of hard to wrap your head around. There's this disease, tuberculosis, right? We know how to prevent it, we know how to cure it, and yet it still kills over 1 million people every single year. So what's going on here? If we have all the tools, what's stopping us?
So to figure this out, we're going to break it down into 5 key parts. First, we'll look at the shocking numbers. Then we'll get into what I'm calling the slogan treadmill. After that, we'll look at why this is so much more than just a medical issue. We'll pinpoint the failure in governance, and finally, we'll talk about what it actually takes to move from just talking to doing.
Okay, first up, the human cost. For a disease that a lot of us have basically forgotten about, the numbers are just, well, they're staggering.
1.3 million. Let that sink in for a second. That's how many people died from TB in the last year alone. We're not talking about over a decade. This is in a single year. It's like a silent pandemic that just keeps raging on, far, far away from the headlines.
And here's the part that's so incredibly frustrating. This isn't some new, mysterious virus we're scrambling to understand. We have had a cure for tuberculosis for decades. The medicine exists. The knowledge is there. But for millions of people, it's completely out of reach.
I mean, just look at the contrast. When COVID-19 hit, the world moved heaven and earth. Trillions of dollars were mobilized, seemingly overnight. It was this massive, unprecedented global effort. But for TB, a disease that has been killing people for generations, the response has just been a pale shadow of that, both in terms of money and, well, urgency.
Which brings us right to the heart of the matter. For a curable disease that kills this many people, why does the world seem to just shrug? Well, a big part of the answer might be in how we've been talking about the problem instead of actually solving it. You see, on a global level, our public health response has felt less like a real strategy and more like a series of marketing campaigns. We're stuck on this slogans treadmill, you know? We just keep shouting louder and louder, hoping that the words themselves are going to change reality. They don't.
Just take a look at this timeline of themes from World TB Day. It's almost comical if it wasn't so tragic. You see the escalation, right? It goes from a polite invitation in 2018 to just sheer desperate insistence. The language gets stronger every single year. But the sad truth is, the disease, it isn't listening.
And here's that disconnect, shown in stark reality. For all the bold slogans, for all the shouting, this is where we are. We are only halfway to our 2030 targets. That gap between what we say we'll do and what we actually do, it's not closing. So what are we getting so fundamentally wrong?
Well, the answer really lies in how we've been defining the problem itself. For too long, we've treated TB as if it's purely a medical issue, something that a new drug or a better diagnostic test can just fix. But the real problem goes so much deeper than that.
Look, new technologies are great. They offer hope, for sure. But here's the catch. They're only as good as the systems that deliver them. Think about it. If you roll out a fantastic new test, but you've cut the services for follow-up care, you've actually just created a new dangerous gap. If you push out preventive therapy without the right support systems, you can end up creating even more drug resistance. It's a double-edged sword.
And this right here is the absolute key. We have to shift our thinking. Tuberculosis isn't just a bacteria. It's a disease of broken systems. It is a social disease that thrives in the cracks of our society.
So what does that actually mean? It means TB preys on poverty. It preys on malnutrition. It thrives in overcrowded housing. It targets people who are already sick with other things, like diabetes or silicosis from mining. It hits the most marginalized people the hardest, and it digs in its heels wherever basic healthcare is weak. This is the real enemy we're fighting. So if it's a systemic problem, you need a systemic solution. And that brings us to the core issue, the absolute heart of the matter, a catastrophic failure of governance and a total lack of accountability. This is the missing spine in the whole global fight against TB.
Let's just break down what that failure looks like, piece by piece. Big global commitments are made, but they have absolutely no teeth, no enforcement mechanism. So when targets are missed, they're just quietly reset for a few years down the line, and there are no consequences for anyone. A lot of the data we rely on is self-reported, which is a massive conflict of interest. And maybe worst of all, the people who are actually affected by TB, they are almost never at the table when the big decisions get made.
So what would real accountability even look like? Well, it's pretty simple, really. It's built on 3 pillars. First, you need independent monitoring, not just letting countries grade their own homework. Second, You need honest, detailed data that tells you exactly who is being left behind. And third, you need real consequences for failure, for all the missed targets and broken promises.
This all leads us to the only real path forward. We have to shift our focus from declaring goals to actually doing the hard, unglamorous work of meeting them.
There's a line that just perfectly captures this whole mess. It's easy to say, oh, the country should lead the fight. But you know what? Power without accountability isn't empowerment. It's just delegation without any real responsibility. It's passing the buck.
And that really is the bottom line. The slogan itself, yes, we can end TB, it isn't actually wrong. We can, it is possible. But, and this is a huge but, it only happens if we are finally willing to get off that slogan treadmill and start building systems that have integrity. We can only end it if we are finally willing to do the work, not just declare it's being done, and to actually be held accountable for every single life that hangs in the balance.